Hello everyone, it's Chris here. I am getting in contact with more details about the exam to support your exam preparation. I've already spoken quite a bit about the exam in lectures, and really even from our first day together. If you think back all the way back to my first lecture this semester, I told you what the exam was going to be about, and that the week 4 feedback assessment was designed to give you a very good understanding of what the exam was about and to rehearse the skills that you would need to prepare for the final exam. And that was no lie. When we go through this little slide presentation that I've made for you, you will see that the week 4 feedback assessment really was a dress rehearsal for the final exam. So let's start going through these slides that I've made for you, and let me give you a more keen sense of what you need to do in preparation for your Psychopathology of Everyday Life exam. Of course, just to cover the basic administrative stuff, the first thing you need to do is find out where and when the exam is, and to do that you need to go to your exam timetable in your student portal. And right now you'll be able to find out when the exam is, and if not by now, but certainly very soon, you will also be able to find out your seat allocation. Your seat number will be released close to the date of the exam. The exam is going to be 2 hours, and you will have 15 minutes reading time. It's going to be short answer format, just like the week 4 feedback assessment. And of course, I've mentioned before, but just to reiterate, you don't need to study for weeks 1 to 3. It's only lectures 4 through to 12, and the associated content. So lectures and associated content presented in weeks 4 through to 12 are what are assessed. That is 9 weeks of content that there is to learn there. And again, readings are accessible to the extent that they've been covered in the lectures in terms of the core topics. So if there is a topic that's been presented in a lecture and there's a reading that accompanies that lecture that talks about that core topic, then yes, I would absolutely be learning about the core messages from that reading. After all, this is a short answer exam, and while you will have very limited time to answer, knowing more will enhance your ability to be able to answer questions as best you can. So let's have a look at some of the exam instructions. You can also have a look back at the lecture I gave. Was it week 10 or week 12? I think it might have been week 10. At the beginning of the lecture, I showed the actual exam cover sheet, and lots of these things are just on this slide are speaking to that cover sheet. So, of course, if we think about weeks 4 through to 12, again, that's 9 weeks, which means there are 9 questions presented on the exam, and you should respond to each one of the questions. And each of the questions has a number of subcomponents. You should also respond to each subcomponent in each question. You should try to get all the marks that you can. There will be little notes where I tell you how many marks are available for each component of each question. And you'll be able to let this, I suppose, guide your approach. Each question will be marked out of 10 points. So when you look at the questions on the question paper during the reading time for the exam, you will see that all of the marks add up to 10 points for each question. Now, really importantly, make sure that you put your name and your student number and the question number on each booklet that you use. And I would recommend starting a new page for each answer that you give. in your answer booklet. So you'll be given a question booklet and a number of answer booklets. You probably won't use all of the answer booklets, but I've just given you a few of them, so you've got plenty to write on. You will need to give all of those things back at the end of the exam. Now, as I said, you're going to be under time pressure. There's 2 hours to complete the exam. You've got 9 questions, so this means that you've got about 13 minutes for each question. Really, what I would be aiming to do is to try and write my answers in 10 minutes and allow a couple of minutes for downtime and reviewing at the end of each question. Now, this is an interesting one. I've received a couple of questions by email over the weekend that have asked me about whether or not the exam answers should be written in essay style. And they should not be written in essay style because you don't have time. You don't need to write an introduction and a conclusion and have a body where you make your point. I just want you to answer the question. And I'll show you some examples of different types of questions in this presentation in a little bit, but you should just go about answering that question as best you can in the time that you have available, and no need to do any sort of introduction or conclusion and body-styled essay responses. And what you will need to do to answer each question will be completely clear when you read the question and you see what the constituent elements of the question are and the marks available for those components of the question. So there's going to be one question for each lecture, and just as you learned in the week 4 feedback assessment, this is going to be about something important. The questions will be about core components of the lectures that have been presented. As I said, the questions will have multiple components, and if you think back to the week 4 feedback assessment and you reflect on what types of questions we were asking there, those questions had multiple components, and here are some of them. So certainly you were asked to name things. You were asked to list some features of things, and so we're talking about experiences of psychopathology or mental disorder here. You were asked to define or to describe experiences, signs and symptoms of mental disorder and so forth. And you were also asked to illustrate things with an example. I think there was a model and you were asked to illustrate a model with an example. So these 4 types of questions, naming, listing features, describing and defining things, and illustrating or applying things with an example, these are going to be very typical, again, of the final exam in terms of the types of questions that we ask. And so you can certainly use this knowledge to guide your study when you review weeks 4 to 12 and the content of those weeks. Let's have a look at one of the questions from the week 4 feedback assessment. Now, you should be familiar with this one. This is one of the questions that was presented in the week 4 feedback assessment. And this one was asking about or focusing on categorical and dimensional approaches to thinking about mental disorder. And what I've done here on this slide is break this question down into its 4 constituent elements. You can see that these 4 elements were equally weighted, and this is what you could do to help you identify the types of tasks that you're being asked to do in questions. You can do this in the exam, but you can certainly think back about the week 4 assessment and deconstruct the questions that you were given and think about their core components and what sorts of things you're being asked to do. In this particular slide, or in that particular question, I should say, there are a few things there. You were being asked to describe categorical and dimensional approaches to mental disorder, and then to discuss the pros and cons, to describe a model and illustrate with an example. So that's really typical of the types of questions that you were asked in the week 4 assessment, and certainly these are some of the things that I'd expect you, or you will have to answer. These types of questions: describing, discussing, describing a model, applying or illustrating a model or some of your knowledge with an example. These are some of the types of questions that you will see in the final exam. So one's just like this, but of course, perhaps with not as many components or not requiring that you write quite as much as you would in the week 4 assessment. You had more time in the week 4 assessment to write your responses, just a little bit more time, but you did have more. I'm certainly not expecting responses that are as long as the responses that you provided in the week 4 assessment. Because I understand that people, for the most part, type faster than they would write by hand with a pen. And of course, the week 4 feedback assessment was completed online. And as well, you just don't have the time. You've got less time to complete the task. So I'm expecting perhaps briefer answers. So you definitely want to make sure you're getting to the point and just providing as much content as you can in roughly 10 to 13 minutes for each question. What you definitely want to do is think strategically and certainly not spend, say, half an hour on your first question, because that puts you under a lot of time pressure for the rest, doesn't it? So you're just going to have to try and be disciplined and think now about how you are going to handle a situation where you feel like you've got more to say, but you're running out of time on a particular question. How would you deal with that in the exam? Would you maybe just jot down some notes that you could come back to if you've got time? There's a few ways in which you can handle it, and I'll leave you to think about that and perhaps discuss with each other on the discussion board. You can certainly do that. I'm aware there's study groups up and running, so this is a very pragmatic thing that you could discuss on the discussion board or in your study groups, and I'm very happy to join in on those discussions too, rather than just tell you what to do. So here is a type of question that you might see, for example. So in this question here, we're talking about postnatal depression, and we're asking you to describe 5 risk factors for postnatal depression. So in this particular question, there's one thing that you have to do, but you have to do it 5 times, essentially. So you would be needing to describe 5 risk factors, and you can see that each one of those risk factors would be worth 2 marks. And these are some of the things that you could put forward as risk factors for postnatal depression. So having a past history of depression or another high prevalence disorder like anxiety, a family history, having unrealistic expectations. So you could certainly break this down into familial considerations, into cognitive considerations here. There's behavioral issues, isn't there? So if you wanted to, I suppose, define different domains of risk factors, you could certainly do that. But these are just some of the things that you could discuss if you were discussing, indeed, risk factors for postnatal depression. That's one type of thing. You're listing and discussing various experiences. So that type of question, the marks available for that were made up of little chunks. This type of question is something that's a little bit more meaty. So this is a different type of question. Here we can see we've got a question about Clark's cognitive model of panic. And you're asked to first describe the primary misattribution that's made by individuals who experience panic attacks and how this misattribution can develop into a disorder. So that's part one. And then the second part is to illustrate how that model might play out with an example. So firstly, we need to define and discuss what the primary attribution is that's made by those who experience panic attacks and how that can develop into a disorder, and then illustrate with an example. And you can see this is just two big sort of tasks you need to do here instead of many small tasks in terms of discussing features of postnatal depression in terms of risk factors. And so here is certainly what you could put forward if you were answering that particular question, and you'd certainly be pointing out that Clark asserted that panic attacks have a very cognitive etiology in terms of there being catastrophic misinterpretations or cognitions or attributions about bodily events or mental events, and physiological sensations are going to be interpreted in some catastrophic way. So if you had a racing pulse, for example, that would be interpreted as meaning there's an impending heart attack, or that one might be going crazy, for want of a better term. And to become disorder, what we see is avoidance and safety behaviors and cognitions in response to this, don't we? So when experiencing these bodily sensations and that catastrophic misinterpretation, we start to see avoidance of the types of situations that would permit disconfirmation of that misattribution, or the opportunity to have that misinterpretation disconfirmed. We avoid those sorts of situations, and as a result, the experience is maintained. And here is a number of suggestions for how that could be illustrated in the second part of the question. Remember, the second part of the question was asking you to illustrate this model. So you could certainly provide, for example, an example where somebody goes running or they exercise, and because they exercise, they experience a rapid heart rate and shortness of breath, which is normal when you're running, of course. They interpret this with that catastrophic attribution. So the shortness of breath and the rapid heart rate is interpreted as a heart attack, and then the person avoids jogging and avoids exercising, which then gives very little, if in fact no, opportunity to have that catastrophic attribution disconfirmed through experience. And of course, you can read more on the slide there. So this is just I'm trying to give you an example, I suppose, of how you could approach this more meaty type of question. I suppose we've looked at three types of questions, haven't we? We've looked at this first one that was from the week for feedback assessment, which had quite an even balance of different types of tasks, discussing pros and cons, discussing a model, and illustrating with an example. And I suppose this is a really good and probably the best example of the types of questions that you'll see on the exam, but what I'm trying to give you is an indication of the breadth of the types of tasks that you might be asked to do. So doing some small task or a number of sort of small tasks, such as listing and discussing core features of risk factors, or doing something more meaty, talking about a model and then applying that model to a particular example is a more meaty type of task. I suppose you have been given a lot of context with that week 4 assessment, and that's really what I would encourage you to do, is to look at those questions, think about the types of questions that we were asking there, think about all of those different types of things like describing, discussing, listing core features, knowing a model and applying it. And, even just listening to me now, listen to what I'm saying. I'm talking about knowing core features. So all the way along throughout our time together this semester, when I've been suggesting that you attend to the core features of disorders and of lectures, that's completely intentional. Everything we've done this semester has been intentional, and intentionally setting you up for, hopefully, success with this exam. Certainly, I talked to you about this metacognitive approach to exam preparation a couple of weeks ago, and there are two things that are really demonstrated to reduce distress and improve exam performance for students. And I'm sure Abby talked to you about these sorts of things as well, but certainly one thing that we can do to help students prepare for exams, to increase performance and to reduce stress, is to provide timely feedback. And that is precisely why we introduced the week 4 assessment, so that it models the final exam. It lets you know very closely what to expect from the final exam and affords opportunity to rehearse the skills that are required for completion of the final exam. The other thing that you can do to help yourself in terms of preparation for the exam is to adopt this metacognitive framework. And I talked about this in the lecture, but to remind you, it's a really good idea to, before you even start studying, start by thinking about exactly what you want from the exam in terms of your grade. Some of you are psych majors and want to get into honours, and you will be wanting the highest grade possible, no doubt. But for others, maybe not. And for those of you who want to get into honours, maybe you've already got a really good GPA and you don't need to stress out too much. You're just looking to avoid that. What people want here will vary from individual to individual. So certainly you can just take an opportunity before you start to stop and think about what grade you want, and then to consider how important it is to you that you get that grade. Now, that's a really good fundamental starting point. Once you take that and you also consider, based on how you're going at the moment and what you know from your essay and your week 4 exam performance, how likely it is that you'll obtain that grade, that's going to tell you about how much time and effort you need to put into study leading up to the exam. The next thing you do once you've done that is to think about the demands of the exam. So the demands in terms of what you're going to need to know, what you're going to need to write, the types of tasks that you are going to need to do during the exam. And I've given you a good idea about what those types of tasks are today, haven't I? I've talked about naming things, listing things, defining and describing things, talking about models, applying models to an example, and so forth. You know that these are the types of things that you're going to be asked to do. Pragmatically, the demands of the exam are going to be writing as much as you can in a 2-hour period. and with your hand and a pen, which is a really old concept, I know. But with that in mind, if I was in your position and I was studying for the Psychopathology of Everyday Life exam right now, I would be taking notes in handwriting, because handwriting is not something I practice very often these days. I am always typing on my computer. I would want to be rehearsing my handwriting and making sure that I could write reasonably well by the time I got to the exam. So if I was taking notes for study, I'd be doing it with a pen right now, or a pencil and an eraser. So once you've thought about the demands of the exam, the next step is to think about which of the Pell resources you will use to prepare. Identify why each one of those is useful and how you can use it to guide your study. And then that is a really good foundation to have laid before you actually start to study. Then you'll know about what it is that you want, how important it is, and how you need to go about getting, or how much time and effort you need to go about getting that thing that's important to you, and what sorts of resources that you will need to draw on. I've been yabbering on about the week 4 feedback assessment because it is the best model. Take what you know from there. What I've said here about the different types of questions that will be asked. Take to the bank my comments about the core features of lectures being examined, if you start to prepare on the basis of all that information, then I would suggest that you're going to be in good form for the exam. And of course, on the day of the exam, I will be there at the exam hall, waiting to see you. And in the meantime, if you want to join in on one of the study groups, there's a couple of study groups that are being discussed on the LMS. You can also, of course, continue to post questions on the LMS. If you've got questions about the content, you should feel very comfortable to discuss the content with each other on the LMS as well. And that's really what I've been hoping would happen this semester, is that people might start to discuss the content a little bit more. And certainly I've started to see that happen recently, which has been great. The discussion board on the LMS is not just for lecturers to blurt answers back at you, but also for you guys to communicate and to discuss and enrich each other's learning. Speaking of the discussion board, your exam for most, but not everybody, will be on the 7th, of course. I would suggest having your final questions on the discussion board by the 5th to ensure that a lecturer can, or a fellow student can respond to them before the exam. That would be ideal. So be sure to have your questions up on the discussion board by the 5th. That'll be great. So everyone, I hope this little video has been useful. I hope that just going over and articulating what the types of questions and tasks that you can expect to have to do in the exam are will help you in your preparation. When you think about the core features of the weeks of content that you're looking at, maybe you'll start to think of, oh, what are the features I might have to list? What are the things I might need to describe and define? What are the models I might need to remember? And so forth. And can I already in my mind start to generate examples of the content and various concepts and models and so forth that I might be able to present in the exam if I need to. So that's it from me, everyone. Again, as always, ask me a question on the discussion board, or send me an email and I will get back to you. Thank you very much for listening, and all the best for your exam preparation.